Next up, it's no secret that among those who've borne the brunt of the pandemic have been nurses. For nearly 2 years, they've been exposing themselves to COVID day in and day out, working long hours, chronically understaffed and overstretched. And that's when they don't have a bunch of people out on COVID quarantine. But according to several nurses, part of a video op-ed in the New York Times, that shortage is intentional, brought on by hospital greed.
There's not a shortage of nurses, there's just a shortage of nurses willing to work under those conditions.
If you don't have enough nurses, patients will die. They will become sicker and they will die.
There have been many instances where patients that die that shouldn't have died. I know that unequivocally. Families, they feel like you've done the best job that you can. And the reality is we're not.
I'm joined now by one of the nurses you just saw, Marlena Pellegrino. She also played a key role in ending the longest nursing strike in state history at St. Vincent Hospital in Worcester earlier this year. She's co-chair of the Massachusetts Nursing Association's bargaining unit. Marlena, congratulations on that, and it's good to see you again.
Thanks very much. Thanks for everything.
That video just knocked me for a loop. A bunch of nurses, people should watch it, but if they haven't seen it yet, tired and mad as hell and can't take it anymore. And a really important point you all make, this just is not just a function of the COVID pandemic. This predates that as well, correct?
Absolutely, absolutely. It's the hidden secret, I think, in healthcare that the general public doesn't know, but this has been going on for a number of years. Nurses just pushed to the limit, not being able to care for their patients and put in positions where it's just untenable.
And the hospital, you all contend, I know this sounds pathetically simple, but I think this is the message. The hospital makes more if a patient gets less care. I mean, that essentially they are embracing the bottom line over whatever consequence there is for the patients who are trusting them. Is that not the pretty clear message?
That's the clear message we've been getting from healthcare administrators and healthcare corporations for years. The less number of nurses you have at the bedside, the more money the hospital makes and the poorer care the patient gets. And their top priority is their bottom line. It's not the safety of patients. And nurses have taken a stand. They've had it with that. It's not right. It's not ethical. And we're doing everything we can to stop it.
You know, and you and your colleagues took the ultimate stand almost a year on strike. But as someone who used to be a union president myself, I think that people naively, outsiders think you fight, you get most of what you want, which you did on staffing issues after almost a year. But when you return to work, what's the feel between the employer, in this case, Tenet Health in a faraway state? What's the feel between you and your coworkers who gave a year of your life for the struggle and the people who just kept saying no?
Well, the feel on our side, anyways, is that we're going in there with our patients as our top priority. We want to get back in the building, stabilize this building, bring some healing about and start caring for our patients. We hope that feeling is mutual. We go in there, feeling very proud of what we've done, but also knowing that there's going to be an adjustment period. 10 months is a long time. There's that hospital, there's been a lot going on in there for 10 months that has brought the level of care down. And we would like to see our hospital return to the beacon it once was. So it's about patients first. Whether you go on strike, it's about putting patients first right now. We want to get back in that building, give patients the care that they deserve. That's why we're proud of the contract we have. We want to use the language we have to better our patients. And we're walking into that building, trying to do that every day.
All of us have read about nurses leaving the profession. It's seen in the video. Video mentions that based on surveys, 40% of nurses are seriously considering leaving the profession. The one thing I learned was what we just played from you. I have mistakenly been saying for a long time that we have a critical nursing shortage. But you contend there's not a shortage at all. There's simply a shortage of nurses willing to work under these kinds of conditions, right?
There are millions of nurses in the United States, and many have taken themselves away from the bedside purposely, not able to, wrestle with their conscience, not being able to provide care for their patients because the bottom line is more important. And at a certain point, when you can't put your patients first and you feel like you're doing more harm than good when you show up every day, you just cannot reconcile, the ethical standard of that. So nurses will, they'll take so much and then they will move away from the bedside. And you worry when we all get older, when our children or grandparents need care, who's going to be there? I mean, I worry about that myself.
You know, I've heard a lot of the rhetoric, and I don't mean that in a pejorative way, which always made sense to me about you need only a reasonable number of people under the care of a nurse. But in this video, you quantify it in a way that really is shocking. You quote The Lancet, which is obviously one of the most respected medical publications in the world from the UK, saying that the odds of a patient in a hospital dying go up 7% for every additional patient that his or her nurse serves. Did I get that right?
That's absolutely true. So every patient, over 4 patients that a nurse cares for, has the risk of all kinds of complications, including death. When a nurse cannot, pick up on subtle changes in a patient's condition, when they can't give them the time and attention they need, people fall through the cracks, and that person is a loved one. And it's very sad to see, but money comes before patients in these hospital industries, and it's been going on for years. And it's something that is the public is not generally aware of. You walk into a hospital, you think there are enough nurses there, you're going to get the care you need, but in the end, patients suffer, and nurses can't reconcile themselves with that any longer.
You know what's really depressing? You watch the video, and I think most people who see it will say something's got to be done. And then you do a little search and you find out that you and your colleagues put a question on the ballot in Massachusetts to do a reasonable staffing level. It was crushed 70-30. And then you read a little more and find out it's because the opposition, the hospital industry, spent $25 million to kill it. It can't be done on a hospital by hospital basis. Not everybody is willing to go on strike for a year of their lives to do this. So what's the path from here to there so that we don't wake up someday and find the whole system is imploded, Marlena?
The path is that people need to pay attention. The public needs to pay attention to what is going on in hospitals. And we need legislation to limit the number of patients a nurse cares for. Every patient that's in a bed is someone's family member, and it might not mean anything to you until you walk into a hospital and you're looking for that nurse who's caring for your husband or your wife. You're waiting for pain medication. You're waiting for a patient to come out of surgery. You can't get updates on patients. It's something that is very important, but I think the public has been naive to the fact that it's been going on. I don't think that people can reconcile themselves with the fact that these corporations put profits and their willingness to put power and greed ahead of patient safety is real.
Well, step one in getting rid of that naivete is to watch that video op-ed in the New York Times and take it from there. Marlena, congratulations on your contract and your work, and I really hope you stay at it. It's good to see you.
Thank you very much for having me. It's been an honor.